Also, in terms of cognitive strategies, there's some literature that suggests that women might benefit a little bit more from different types of cognitive strategies. That the acceptance and positive reappraisal, acceptance being when you're becoming accepting of your negative thoughts, not judging them, and the positive reappraisal, trying to look for the bright side of difficult things, actually tend to be related to less worry and stress for women, not so much for men. Men may benefit a little bit more from refocusing on planning through a stressful situation. So that's just, there's some interesting differences around the way in which women and men may handle things. And of course, I think it's probably not necessary to say in here, but it's probably good to reiterate that we're not looking at gender as a continuum. It's not like you go from maleness to femaleness. We're looking at dimensions of how one handles stress and worry on a dimension. And males and females are definitely overlapping. So there's just those overlapping curves. The actual differences tend to be not huge, but they tend to be pretty stable across different studies. Another intriguing one, which people who know more about trauma might want to chime in a little bit more on this, it's well established that women will develop PTSD more often than men, even when you control for rates of exposure, but you can't really control for type. So women do still tend to experience more personal, sexual victimization than men. Men might experience PTSD or trauma more in the context of war or exposure to violence. There might be something subjectively different about that would predispose somebody to develop more of a significant trauma reaction, but some of the research in this area hypothesizes that there may be something around the way in which women are processing this trauma. It actually makes it more difficult for women to get over it, I guess. So that's kind of interesting as well, and has implications when you're talking about treatment planning in juvenile justice because the rates are so high. In the personality literature, this is, I think, a really interesting finding. I'm going to ask you guys what you think about it. So I believe this was the Big 16 personality inventory they did, and it's been done across the world. They've done this in numerous cultures and contexts across the world, and this study, I think it was 2001, pulled these together into a meta-analysis. And they were really careful to emphasize that there are a lot of within-group differences. So in no way are women looking one way and men are looking one way. There's a lot of differences. But they do see these kind of stable, small differences where these are all self-report. So women are reporting more openness to emotions, more nurturance, warmth, vulnerability across a lot of different cultures. And men are reporting more of this excitement-seeking, assertiveness. So here's the interesting part. The self-reported personality differences are larger in more Western, individualistic-oriented, non-traditional gender role countries. They're larger. They're smaller in countries where you have more circumscribed traditional gender roles. Anybody have any? I don't know what's right. I know what the authors concluded, but anybody have any ideas about that? Why that might be? Their self-reported differences.
You've looked at this, and you feel confident the measurement there. I mean, huge measurement issues and measuring cross country.
No, that's true. It was the same assessment, the Big 16, same dimensions as for how it's kind of administered or whatever. Yeah. It's hard to control, but their finding is that the differences were larger in Western countries. Any ideas? Assuming measurement was accurate? No? Unless it has any?
Maybe just cultural expectations of how you present your personality when someone is screening your personality.
So maybe that, potentially.
Maybe there's no need to amplify within yourself a sense of having these traits that you don't have to put up a front about in public because you're allowed to have a broader range of ways of being.
Maybe, yeah. I think, maybe. Who knows?
Maybe we overstate just how individualistic we Western countries actually are.
Their assumptions about what we are is a little off.
We like to think certain things about ourselves.
What the authors concluded was that in countries where you have more options for how you can act, you are going to ascribe your life choices to internal characteristics. So if you're more likely to say that because it is statistically still true that even within Western countries, women take care of kids more often and kind of participate in some of those traditional activities, even though there's more options for that. Whereas in more traditional countries where gender roles are more circumscribed, because you don't really have a choice, you wouldn't necessarily ascribe your choice to mother your children to an innate sense of nurturance. It's just what you do. So maybe you would actually describe yourself as someone who's something else, really, assertive or open to ideas, and that's just what you do. So anyway, that was kind of their conclusion.
Yeah.
It's interesting.
It's,
Anyway, so to talk a little bit about the idea of the actualization being different. So this really comes from more the feminist Gilligan camp, where anybody, we recall our Psych 101 classes, we talked about Kohlberg and Gilligan and kind of the debate around moral reasoning. And Lawrence Kohlberg came up with this hierarchy of moral reasoning, where the very highest level of moral reasoning is a justice orientation, where you are ascribing to these abstract principles of right and wrong, and that's how you make your moral judgments. It's very Kantian in the sense that there's actually those principles out there that you are ascribing to. And Carol Gilligan came in and did these sort of in direct contrast to Kohlberg's theory, did all of these interviews with women and found that women are much more likely to reason morally around the ways in which their actions will impact others. And she called it a care orientation. And that was lower on Kohlberg's hierarchy. So women were then generally reasoning at a lower level. So Carol Gilligan comes from more of a postmodern, they're not better or worse, they're different kind of place. And subsequently, with other kind of influences, this whole sort of area around female development really based heavily on this kind of care orientation or relational idea that women are very relational and think about the world and think about things in terms of relationship develop. So the highest level of actualization in the traditional view would be individuation, where you actually become more self-contained. But in a relational theory of development, the highest level of actualization is the development of healthy mutual relationships. And through, how women are traditionally vulnerable to being silenced because they're trying to preserve relationship and just trying to understand the ways in which these work in women's lives. So you would focus on empowerment and voice, and those are words that are all over this literature, and particularly within gender responsive within juvenile justice. So support for the theory is mostly qualitative. The next slide has a little bit of quantitative. But, they're really coming from a different place. Qualitative research and a different way of thinking around research is actually the way you're supposed to go, not quantitative, because that has all those other assumptions about where we gain our knowledge. So it's really appropriate within this context, and it's just, there's actually an interesting polemic out there right now with it's very similar to the cultural competency kind of adaptation world, where there's this camp that's it is ethical. It's just an ethical imperative to treat women and girls this way. And there's the other camp that's is it effective? And it's really hard to communicate across those camps because their kind of language and their goals are so different. There's a couple, there's a researcher out there, Matthews, I'm not remembering her first name, but she's done a really nice job of trying to kind of in the literature, see if she can bring them together to commonality. But it is a tension. I don't, more the feminist camp doesn't feel like they have to have these things empirically proven, And then on the other side, they're we got to know how to fund things, and we have to know what kind of recommendations to make around practice. So it's just.
But that camp must explain what empowerment is intended to lead to. When you say treatment focuses on empowerment, what exactly does that mean? Empowerment with what ends? Is it?
I think it would be the same outcomes. I think from what I've read, I think the concern might be that you don't want to stop this movement until you've established the research base for it, you know? Because I think, yeah, you want women to, not, you know, be developing these healthy relationships, which would mean that we wouldn't be relying on substances, which is a proxy relationship, and you know, you would have self-esteem, and you would be out sort of getting your own, and you know, you wouldn't be getting entangled in these other things that seem to drive more maladaptive behavior.
So it's still foregrounding the healthy relationships to the empowerment towards actualization that's female specific. Not overcoming that conceptualization of successful growth, obviously, is not the point of the empowerment that the treatment is.
Oh, no. Yeah, it's in support of that. Yeah. So just to kind of sum up, getting back to the quantitative world, looking at meta-analyses on differences. So most of these are psych bulletin articles. So women, more likely to develop PTSD. We kind of talked about what might be driving some of that. Temperament in sort of early adolescence, childhood, early adolescence. Girls higher in effortful control. Boys in this idea of surgency, which I think is a great word. Like, it's really, like, I get that, surgency. The more that outgoingness, dominance. The moral reasoning. Oh, my font didn't show up. So that's a small differences showing girls. It's nice differences. So that girls do tend to reason in that carrier orientation. So this is interesting because obviously the whole assumption around the carrier orientation is that this is what women do. Quantitatively, you do see small differences that might be what women do. Not, definitely not universal. Self-esteem, you do see higher self-esteem in males, but it's much more pronounced in late adolescence. My next graph, I have like a little illustration of that. And risk-taking, higher in males in adolescence for sure. Depression, we know that there's that difference. That starts to develop after the age of 15 for girls. And aggression across all ages and everything you can think of, males are more likely to be aggressive. This is my dramatization. This is not based on real data, but I thought it would be nice to kind of show what seems to happen here. So you see girls and boys being about the same, you know, in late childhood, and then girls just like, they just dip. It's just like a really tough time for girls. They kind of hit bottom around 16, 17, and then my age intervals are not equal there, but they tend to come back up, but stay a little bit lower. What's really important, though, is that the trajectory interacts with ethnicity. And this study from '99 showed how the basis for girls' self-esteem and the trajectory differed between white girls and African American girls. Big risk factor for lower self-esteem was body image. It was just more pronounced in white girls, but you would see it affecting some of the African American girls' trajectory as well. So it seems to be a huge component of that difficult time around girls trying to figure out like where their value is and trying to interpret that in adolescence, and tends to be really wrapped up in body image and how they're perceived by boys. So the summary, I think we can confidently say that there are some small and stable differences, and that those differences do have implications for the ways that you would intervene with girls, because they are around cognitive strategies on the ways they view relationship and on mental emotional health. In adolescence, and specifically, with strong areas of difference in self-appraisal, emotional health, and externalizing behaviors. But it's really important to kind of keep in mind that this interacts with ethnicity and other cultural influences. So again, we're looking at that continuum, that overlapping continuum. So my summary of the summary is, there's probably some good reasons to think about intervening in different ways with girls than with boys. So let's talk